All right.
Welcome, welcome. I'm so glad that you're here, and it's my privilege and honor to introduce you to a good friend of mine, Alan, coming all the way from Massachusetts to talk about the healthcare profession. Thank you for being here, Alan.
Yeah, my pleasure. It's good to see you again, and it's been one long year with COVID, and but we keep moving along. And today I'm going to talk about primarily the healthcare fields. I work for Massachusetts College of Pharmacy and Health Sciences. It is the oldest university in the city of Boston. It is one of the oldest schools of pharmacy in the country, but quite honestly, we have everything. And so, as far as majors go, so this is really fitting this presentation. I'm going to, in the end, talk about the school, but certainly, as you can see from the list of all of the majors that we have, it's fitting to certainly be able to talk about them and how, and certainly within these majors and programs, such as nursing, pre-med, which I think those are the two most, for the past couple of years, it's been really nursing and many students wanting to go into medical school or dental school. So certainly, I'll be more than happy to talk about them and certainly what to expect, what a student academic profile should be. So let's just get right to it. Might as well start with nursing. Here it's a 3-year accelerated 4-year degree program. Um, Traditionally, it will certain, and there are two types. There's pre-nursing and there's direct nursing. We are direct nursing, but there are pre-nursing. I think it's advantageous to definitely look for coming out of high school, going in these direct entry programs in nursing, because once you're in, you're in. You don't have to worry about reapplying later on down the road, or you don't have to worry about going through interview processes and application processes and all these other transcripts being sent and stuff. If you can certainly apply to a direct entry program out of high school, that is the best way to go. Biology and chemistry are a must. With us, it doesn't have to be AP or IB. It can be just base biology and chemistry, though I prefer that. But honestly, they're the foundation of medicine, and pretty much whether you're applying to any health science related major, biology and chemistry is extremely important to have, certainly in the field of nursing. I think the toughest class that a student's going to face in nursing is pathopharmacy. They actually have to take that class to learn about the different types of medications. And as you get into patient care and those things, that becomes vitally important because they will be having the communication with the doctor and the pharmacist. You share the patient with all these different healthcare practitioners. So at the end of the day, it's all very relevant. And pathopharmacy definitely will be the toughest course. The nice thing about the accelerated programs like ours, the 3-year accelerated program, is the fact that you are in and out in 3 years. It's fall, spring, and summer, so there's really no loss of knowledge from one year to the next because it's back to back to back. And there's an extra year of income. You're getting out early. You're hitting the ground running. And so certainly as you look at not just nursing programs, but any one of these majors throughout the country, throughout the world, make sure that there are internships assigned with them and attached with them. That is vitally important. We are across the street from Harvard Medical School, and we are surrounded by the 6 Harvard affiliated hospitals. We are the oldest, as I'd said, university in the city of Boston, but our students do their internships and research through the connections and the affiliations that we have with these hospitals. And specifically in our program, for example, because we are certainly have articulation agreements with the Harvard teaching hospitals of Boston, a nursing student or any one of our students will be able to get experience in areas such as HIV, cancer, diabetes, pediatric oncology, nuclear medicine, ambulatory care, drug and research development, and diabetes, pediatric diabetes. So it's certainly important. Location is very important. So certainly you want to make sure that you're going to a school in any health science related field where there are internship opportunities. There are a plethora of hospitals in the area. That's really advantageous and important that those resources are in place. Um, Med school, vet school, and dental school, very popular. Average age of a student in med school is 25. Experience is vitally important. Med schools really are, of course, looking for students who have a strong science background, but communication skills are extremely important. Med schools really look for communication schools. We have to communicate with patients and other healthcare practitioners. As I had said before, in nursing, the nurses, as a nursing major, your toughest course is going to be pathopharmacy because you have to understand meds, you have to communicate with the pharmacist, and you have to really talk to the doctors, the PAs, and all those folks while working on one patient, the doctor, surgeon, anesthesiologist, whatever the case may be. Uh, you know, Communication skills are very important. Those med schools are really looking at that. They're looking at experience too. Again, we're across the street from Harvard Medical School and we're surrounded by the Harvard affiliated teaching hospitals. So, like all of our programs, especially in our pre-med program or our BSMD program or BSDO program, which I'll break down, those definitely have internships attached to them, research opportunities as well through those Harvard affiliated teaching hospitals. A medical doctor focuses on specific symptoms of the human body. A doctor of osteopathic medicine focuses on the entire body. Today, they are one and the same. They are licensed the same. They take the same board exams. They are looked at and revered in the same way and respected in the same way. In our BSMD program, that's 4 years undergraduate, 4 years med school. And the BSDO, that is 4 years undergraduate, 4 years graduate. But I want to talk about this because this has a conditional acceptance admit process, as does, or provisional acceptance, as does our BS dental medicine program. In both the BSDO and the BS dental medical program, if a student applies and they're accepted, they have the opportunity through us they have the opportunity to interview with the med school and the dental school that we work with. Uh, that opportunity is also available to students in their first or second year with us on campus. So they don't have to really interview in their senior year of high school if they don't want to, but many do. In that case, in the world we live in now, it would be virtual. And if they pass their interview, they're giving a provisional acceptance letter to med school or dental school in their senior year or their first or second year with us in their freshman or sophomore year. Because of the pandemic, we are now SAT, ACT optional, with the exception of some of these programs. The BS MD and the BS DO, those and how the program works is prior to COVID, you wouldn't have to take the MCAT, your SAT or your ACT was good enough. And certainly you're admitted early, you maintain the required GPA, and you go straight into dental school or med school. When COVID hit, we had to kind of change some things because the SATs and the ACTs were being canceled. It was hard for students to sign up to take them. So we went optional, SAT, ACT optional. And most of our programs, with the exception of these students can either now submit the MCAT for the dental, or excuse me, the dental is the DAT, the DAT. That's their version of the MCAT. The DO and MD is MCAT. They can either submit the DAT for dental, MCAT for medical, or for the dental or the medical, they could submit a copy of their SAT or ACT if they take that. That will be in place of the MCAT and they will be acceptable. There is, of course, a benchmark that students have to meet there. We can talk about that when they apply. That is an option there. It's very popular, 8 years, very competitive. Or students can get to med school, vet school, or dental school through our pre-medical and health studies program. In all of these majors, in all of these programs, there is a strong foundation of course, science courses, but humanities courses and communication courses and English courses. You got to be able to communicate. Again, med schools are looking for folks with strong communication skills. Remember that average age is 25. Some people are older with experience going back to school. So at the undergraduate level, competing with that, again, our students are able to take advantage of those Harvard affiliated teaching hospitals in the area, really giving them a strong resume for med school. I had a freshman in the cardiac ICU at Mass General, a major hospital, major research, teaching hospital affiliated with Harvard Medical School. I had a second year student doing stem cell research at the Dana-Farber Cancer Institute. All of our students have the opportunity to do the summer SURF program, summer undergraduate research fellowship through Harvard Medical School. I had a senior, she was working out of the Boston Children's Hospital extracting DNA with a group of scientists and doctors to find a cure for cancers and seizures. And now she's doing a residency at the University of Southern California in LA, fight on. So, and that's how that works. And if you're going to compete with these folks who are older, you've got to have experience, strong communication skills. That's vitally important. Vitally important. Veterinarian medicine, the same way. And those are 8-year programs. So BSMD, BSDO, BSDMD, dental medicine, and our pre-med to vet program, all 8 years. Pharmacy, physician's assistant, optometry, physical therapy are 6-year programs. Students complete those in 6 years. PA has become very, very popular, and it's become very, very competitive, along with nursing and pre-med and the BSDO, BSDMD, and vet programs. Again, developing those strong communication skills are very, very important. Being able to effectively communicate, I can't emphasize that enough. That is extremely, extremely important. The PharmD program, that's still no PCAT. So that's either a 5-year accelerated program or a 6-year program, no PCAT. Pharmacology and toxicology is a side effect of the drug and how that reacts to the human body. It is possible for somebody to enroll in pharm tox and go on to med school, or go on to pharmacy school, or go on to PA school. That's really, really an option, and that's a crucial part of all of that, understanding how that works and working with the Food and Drug Administration. So certainly pharmaceutical sciences is more the research side of things. Pharmaceutical healthcare business, that's the business side. There's a lot of medical device companies in San Diego, throughout all of California now. So going into business, whether that's healthcare management or being a pharmaceutical sales representative or going into pharmaceutical and healthcare business, is very lucrative and very rewarding, and a great avenue into the business world for sure. And though there are a lot of job opportunities in these fields, dental hygiene is actually very popular. Becoming a dental hygienist, those folks do very well. These are all licensed programs. So whether you're going for your bachelor's, your master's, or your doctorate degree program, these degree programs are all, of course, accredited, but they're all licensed. And certainly that too, the dental hygiene program is a 3-year accelerated 4-year degree program. Those students complete that fall, spring, and summer in 3 years. Some of them elect to go on to dental school through dental hygiene. You can do that too. It's 3 years of dental hygiene school. And then an additional fall semester that preps you for dental school. I think these are folks that someday want to be entrepreneurs and open up their own dental office, and people do that. And that's a great way to learn how to also take some business courses and learn how to run a business, but understanding the dental hygiene side of things, and the dental side of things and the business side of things can really set you up as a successful entrepreneur in the medical field. And a lot of healthcare professionals are doing that too as well. And surprisingly, but not, these 3-year accelerated degree programs are very, very popular. DMS, MRI, nuclear medicine technology, radiation therapy, and radiography. Like dental hygiene, they are, and like nursing, they are 4-year degree programs done in 3 years. They're all licensed, and all of these graduates do extremely well, successfully, financially, and professionally. Especially in the world we live in today, there is no shortage. We need, well, no, there is a shortage actually. There's, with everything going on, we need as many healthcare practitioners as we can. So certainly, I think, again, thing to remember, thing we can kind of tie it all in is communication skills are very important. Yes, we got to be science and math focused, but you really have to be able to communicate as well. That is vitally important, and that's what these people are really looking for nowadays. Moving along now toward kind of MCPHS and how we operate, we are a 17-to-1 student to faculty ratio, average class size 20 students, not going to get lost, not going to fall through the cracks. 1,000 incoming freshmen, 5,000 overall. 98% of our kids pass their boards, 100% of those get jobs, 80% go to med school, vet school, and dental school. We retain roughly 95% of them. We surround our students. We're a teaching university. Our faculty are doctors and healthcare practitioners, but the focus is on student success and them becoming healthcare practitioners and researchers. So the research and all of that is done on the student side. The faculty has already done that. They've been published. They've had all of that stuff. before and gone through all that and achieved all that. Now they want to teach our students and get them to that level, and that's what we do. Teaching assistants are not allowed to teach or lead instruction. They can answer questions in a lab, but that's as far as it goes. It's really professor lab. They are our students' faculty mentors, they're academic coaches, they're peer mentors, they're peer advisors. They really are guiding our students. They help them apply to medical school, vet school, and dental school. They help them with research. They do all of that. I want to talk about interprofessional education in the healthcare and health-related fields majors presentation here today because it's very important. I think the fact, and I can give you one example that we do at MCPHS, our healthcare psychology students will often work with our pre-med students and our pre-dental students on the psychology of a patient, knowing that a dentist and a dental hygienist is going to put their hands in people's mouths, it's going to pinch, it's going to hurt, you're going to feel it. And it's really important to understand the anxiety and or sometimes the uncomfortable feeling many patients have before this happens, although dental practices have come a long way and since since what they once were many, many years ago. But so oftentimes there's a lot of cross-pollination going on. Our healthcare psychology students work with our pharmacy students, work with our PA students, work with our dental hygiene students, and just kind of understanding that patient, that's really the patient mentality and mental approach, and that's really important. Internships are vital in all of these health-related fields. Must have internships, must have places. Location is extremely important. Students must have those available to them when they need them to do them, because that's what med schools are looking for. Progressing on into a PA program or a pharmacy program or a nursing program, being able to get clinical hours, being able to do rotations. Those are real internships, pretty much. We call clinicals and rotations in the medical field. That's very, very important. You got to be able to get that experience in working with people in different settings and different environments. That's incredibly, incredibly important to one's success and one's professional growth in these fields. Our career success is very high with our students. They're certainly the highest earners in the New England area, more so if you were to measure that against Harvard and MIT higher. They're very successful. They work hard, though. They work very, very, very hard. But at the end of the day, it's what they want to do. They're very successful. They're very passionate. The environment's very passionate. And they're doing pretty good at the end of the day. As I said, they work hard, but they definitely, certainly earn it. That's for sure. There are more than 100 plus organizations, 50 clubs and organizations, 26 sports, fraternities, and sororities. We're a member of the colleges of the Fenway. It's oftentimes I try to squeeze that in. There's so much more, and people have so many questions about the students doing internships and research through the Harvard teaching hospitals, and that's a big deal. But actually, student life is a big deal as well. And so certainly through the colleges of the Fenway, there's a consortium that we belong to where if you're majoring in PA or pre-med and you want to take an art class or a theater or drama class, you're able to do so at no additional cost. You can cross-register at these schools. We're right next to them. So I always tell students their social network is going to expand without the use of social media in a city like Boston and surrounded in a city where, for example, we're across the street from Harvard Medical. MIT is behind us, along with Harvard's main campus, BU, BC, Tufts, Northeastern, and all of these, and Emerson, and all these other great schools. So 250,000 people, all under the age of 30, all college kids, and a lot to do. Study abroad is a very big deal. As a parent and as a student looking at housing for college, let's just talk about that, even though it's not a part of the presentation, but it's going to be a question that you're going to have. They've come a long way since the dorms of the past. They are suite style, they are apartment style. Some of them have kitchens and bathrooms in their dorms, so they don't have to share that with the floor. Some are traditional, but for the most part, dorms have come a long way since I went to school in the late 90s, early 2000s. Free to apply here, no application fee. By simply applying, students are automatically considered to be eligible for scholarship money. We provide roughly $25 million a year in scholarships and financial aid, and over 95% of our students receive one or the other or both. There's certainly no additional application to apply or fill out in regards to a scholarship. Remember, private schools, no out-of-state tuition fees. SAT, ACT optional, with the exception of some of the programs that include the BSDO or the BSDMD. Students can actually take the SATs and use that instead of the MCAT or the DAT. So there are just a few. We can certainly always reach out to Amy or myself, and we'll be glad to talk to you about that. One letter of recommendation, preferably from a guidance counselor, Amy, someone in her position, who knows the students very, very well. certainly the transcript. Make sure you have biology and chemistry. There's a reason why I continue to say that, and it's not because uh, it really, sometimes students might take physics instead of chemistry. They may have biology but not chemistry, or chemistry but not biology, but you need both. Certainly in again, free to apply, no application fee, and all of our decision deadlines are not binding. So early action 1 is November 1, early action 2 is December 1. If those students apply by then, they hear back shortly, and they have till May 1 essentially of the following year to let us know what their plans are. And we want them to have options. We want them to apply to other schools. We want to make sure this is what they want to do, so we don't bind them to a particular agreement. Regular decisions February 1st, but I always like earlier the better, simply because it gives you more time to do your research, to talk to folks like me, talk to folks like Amy, talk to current students at these schools, get their perspective. I think that's incredibly important. Uh, this is also incredibly important. March 15th is the financial aid priority deadline. Make sure you have your FAFSA all filled out, the free application for federal student aid. Make sure you have that done when the moment you can apply for that, because it's really important to get those aid packages in and really understanding what we need to pay, what the overall cost is going to be. Certainly will help you with that, but the sooner you get that done, the sooner we can do that. The application portal is incredible now because you don't have to wait by the mailbox. And I remember when I first started in higher ed many years ago, I live in California now, but I'm from New York originally and lived in Boston early on in my career with MCP. In the last 9 years, I've lived in California working with West Coast families and students and counselors. And I remember the blizzards would hit, and sometimes that would delay mail, and sometimes that might delay your decision letter. Now you don't have to worry about that anymore. There's technology that's replaced all that. The application portal with a username and password, you're able to track. You're able to set this up, and you're able to track the status of your application. You can find if you're missing something, it will tell you, missing a transcript or whatever the case may be, and you'll even get your decision before you get your letter in the mail. I mean, mail still comes, but you're able to know ahead of time, and you're able to kind of manage that from this portal, which is incredible. So, um, uh, definitely technology is improved and definitely makes it easier in this process too as well. This is just a snapshot of some of the scholarships that you get. I think it's important to know in our majors, whether it's PA, PT, pharmacy, nursing, the scholarship is renewable each and every year, essentially maintain a 2.5 GPA, and you can carry that from the undergraduate portion of the major to the professional part of the program. When you look at our tuition, no tuition is cheap. College is an investment. Can certainly planning needs to is important. But if you look at our tuition versus most of our competitors, it's not bad. Our base tuition, you can see the differences between the accelerated and the non-accelerated, and this is without scholarships and financial aid. And with scholarships and financial aid, that goes down tremendously. So certainly our students, based on our tuition not being that bad really, and the return on investment being a student salary is much higher than their tuition here, the level of debt is little to none. They're doing pretty well. And I'm going to leave this up for a little bit so you can jot it down and take notes. Or if you're watching this recording, you can certainly jot it down. I read applications from California. I communicate regularly with Amy. So we've been working together for a really long time, and some great students who have come here and have been very successful. And so certainly reach out to her, reach out to me. Talking to her is just like talking to me, and she'll relay the information to me. But certainly, I live out here, so even though there's a Boston area code 617 number on there, I did that so you wouldn't be confused if I call you and a California number saying I'm from Massachusetts College of Pharmacy and Health Sciences. So I tried to keep it all relevant for you. But reach out anytime. I'm glad to help and certainly answer any questions that I may have. And at this point, I'm going to pitch it back to Amy to see if you have any questions or if she has any questions. Let me stop sharing the screen.
Okay, let's see. It took me a moment to get my monitor back on, but we have a couple of students here. Maybe it looks like a parent. Feel free. Actually, I'm going to turn off the recording.
Yeah, absolutely, guys. Feel free. Any questions?